Good evening, and thank you for joining this live toll-free telephone town hall meeting with your Congressman Randy Weber. This evening, you will have an opportunity to hear from Congressman Weber and other government officials regarding the latest updates on federal and local Veterans Affairs. On the line, we have Mr. Francisco Vasquez, Director of the Michael E. DeBakey VA Medical Center. Director Vasquez is in charge of managing the most complex VA medical center in the country. In addition to caring for more than 114,000 veterans in Southeast Texas, MedVAMC also serves a regional and national referral center for many services, including cardiac surgery, liver transplant, traumatic brain injury, epilepsy, and other neurological disorders, as well as radiation therapy and spinal cord injury care. We also have Sandra White, a nurse manager from the VA's Care in the Community office, Mr. Edward Perry, who will be online with Veteran Services representatives and able to respond to any disability claims related to or as well as general issues. Ms. Patricia Cruz, Assistant Loan Production Officer, is on the line, and she'll be able to respond to any VA home loan guarantee-related issues, as well as Ms. Barbara Brookins, who is the Employment Coordinator, and she'll be able to respond to any veterans' readiness and employment-related issues. We also have others that will be on the line to answer questions about veterans' benefits claims. But before we begin, I just want to give everyone a few quick reminders, and this is going to be important if you have a question. What you'll do is you'll press *3 on your telephone keypad. Again, *3 on your keypad. So if you have a question for Congressman Weber or anyone on our panel that we mentioned, you'll press *3. You'll be placed into a queue. Someone from our staff will get the question ready. This is an important topic. We have a lot of folks on the phone tonight, so we are going to get to as many questions as we can. Every question that you have is important. So again, just press *3 on your telephone keypad. You can do it now or at any time, and we'll be sure and get it to as many questions as we can tonight. So with that, I'm going to turn it over to your Congressman, Randy Weber. Congressman?
Well, thank you, Jason, and thank you, friends, to all that have joined us this evening, especially our friends from the VA. And Jason, I know you called Mr. Vasquez Francisco, but I know him as Frank. We went to church. I probably shouldn't out him like this, but we did go to church some time back together and sat with him and his lovely family behind us. So we're quite grateful to him for being here. And quite grateful to all of y'all for being here. Oh, you know, it's been incredible over the last few years. Southeast Texas has been hit with some really hard and trying times, needless to say. And even as we were still recovering from Hurricane Harvey and Tropical Storm Imelda, what happens? We get hit with the COVID virus, and on top of that, Hurricane Laura. So the southeast part of Texas has really taken on the chin. And then, as if that wasn't enough, just when we're trying to kind of get back in the swing of things, we get hit with a once-in-a-lifetime winter storm in February, and it was unbelievable. 18 degrees in Galveston. I did a weather research, and the site I found said the last time it was 18 degrees in Galveston was in 1895. Contrary to public opinion, I wasn't alive back then, but, man, it was cold. And I'll tell you what, it's about time Southeast Texas got a break. We could use a break, man. But you know what? We know people that are on this call, our great VA, who never took a break. They were right down the line. They were steadfast. They were doing a great job for our vets, and we really applaud them and thank them for that. Tell you what, in that flooding stage, whether it was Imelda or Harvey over in Beaumont, when the Beaumont VA facility, which services about 10,000 vets a year, took on almost 9 inches of water, the building had some significant damage. And we actually went over there and looked at that building. But that didn't stop our great VA. A trailer from Mississippi was acquired, tents from Arkansas, and even mobile medical units from Houston. And by golly, we set up a mobile clinic right there in the parking lot in Beaumont to keep servicing our great vets. It was a little tough, a little tedious. It wasn't the Didn't have the volume that we wanted it, but we certainly wanted our vets to get as much as we could get done right there. During the early months of the COVID vaccine rollout, the Houston VA was getting our great vets vaccinated at record speeds, and we were grateful for that. And then as early as the beginning of March, they were offering the vaccine to any veteran enrolled with VA healthcare system, regardless of age, not only at the main campus, but also at satellite locations, such as Texas City in Galvin County in the VA outpatient clinic. And, of course, now, nationwide, the VA administers COVID-19 vaccine walk-in appointments for veterans, for spouses, and even for their caregivers. It is just unbelievable. We're so grateful for all that they're doing as we're beginning, hopefully, to get a handle on this crazy virus. Not only did the Veterans Health Administration celebrate its 75th milestone anniversary during National Volunteer Week this past April, some of you may know, the VA Voluntary Service, believe it or not, marked 1 billion hours, that's billion with a B, that volunteers have given their time in service to our veterans at VA facilities. And that's not all. They're not stopping. In the last few months alone, Congress and the VA have been working together to make sure that those who selflessly served our country get the service they deserve. In March, for example, the Department of Affairs started implementing steps to improve its post-traumatic stress disorder, PTSD, claims processing. And boy, was it needed. They're on top of it. They're going to make it bigger and better for our great vets, so stay tuned. We're working, folks. In April, the Department of Veterans Affairs made it easier for patients and their families to access information about VA benefits and services by creating one single site, va.gov. Let me repeat that website. It's va.gov, which is actually now the central portal for accessing VA benefits. In May, as part of Mental Health Month, the United States Department of Veterans Affairs launched One Step Today to provide mental health guidance, the resources and sources of support, as well as community treatment options for veterans on their mental health journey. One Step Today was actually developed by veterans, just like y'all, just like many of our veterans, hopefully on the phone with us, and those that you know, to inspire their fellow vets to start on a path toward recovery, toward well-being, and a healthier tomorrow, all one step at a time with a lot of the care and support that they deserve. This Memorial Day, the VA's national cemeteries have announced they will allow mass flag placements across the U.S. to commemorate Memorial Day, just like it happened before the pandemic. And why not? The pandemic might keep folks in a hole, inside for a while, but it will never be able to keep our patriotism down and our gratitude for our great vets. All 155 VA national cemeteries will be open Memorial Day weekend from dawn to dusk. I love that. Absolutely love that. We're coming out of this pandemic. The VA will also continue its partnership with Carry the Load this Memorial Day to honor the sacrifices made by our great military, our veterans, our first responders, and their families. These are just a few of the examples of how the VA is honoring the commitment to our great veterans. So as Jason mentioned before, we have some outstanding Texas VA officials on the line tonight to answer your questions. Once again on the line, we have my good friend, Director Frank Vasquez of the Michael E. DeBakey VA Medical Center. We have Sonja White, Nurse Manager of Care in the Community. Mr. Edward Perry, Veteran Service Representative for Disability Claims and Most General Issues. Mr. Cruz, Assistant Loan Production Officer, for questions regarding VA home loan guarantee related issues. And Ms. Barbara Brookins, Employment Coordinator, who will be able to respond to any veteran readiness and employment related issues. We got a panel of experts on the phone with us tonight. We are so grateful to them for taking their time. They will be able to answer any questions you have about veterans. And if there's a question that we can't get to tonight for whatever reason, again, I'll remind you what Jason said, press *3. If you have a question, that'll put you in the queue. But anytime you have a question, please press that. We appreciate our great VA folks on the phone with us tonight. And beyond the time allotted for tonight's call, if you still have a question, you still want to get information, let me encourage you to subscribe to my e-newsletter. You can visit weber.house.gov for weekly updates about what's going on in both Washington, D.C., and most importantly, Texas 14. And now, Director Vasquez, would you give our constituents a brief update on what's happening here in our area? And I'll yield to you, Frank.
Absolutely. Thank you, Congressman Weber. Good evening. I'm very thankful to you, sir, for inviting me and my staff to this town hall, and I want to give a heartfelt thanks to all of the veterans online for their service. As you stated earlier, the Houston VA is one of the largest VA medical centers in the country, and we're very fortunate to care for more than 130,000 veterans in Southeast Texas. And as a Navy veteran and a VA patient myself, I, together with all of our employees, truly consider it an honor and a privilege to care for the veterans who have served our country. Working in a hospital during the pandemic or the past year has been very challenging, and our COVID numbers mirror the COVID numbers in the community since our veterans and staff live and they work there. When the pandemic hit, we quickly pivoted to virtual care, seeing many of our veterans via phone and our VA Video Connect application. And over the past few months, as our COVID numbers have remained low, we have opened up our in-person services. But many of our veterans are choosing to receive their care virtually still. It is super convenient and it's easy, and there's no dealing with traffic and with parking and so on. So that has worked out really well. But I want you to know that our Houston VA and our clinics have remained open during the pandemic and will continue to be open for our veterans moving forward. As Congressman Weber mentioned, May is Mental Health Month, and since the pandemic, we have seen our mental health consults rise at our VA. In fiscal year 2020, we had 5,680 new mental health consults, and so far in fiscal year 2021, it's only been half the year, we have had over 5,000 new mental health consults. So we're on track to double last year's number of consults, and we're excited about this because it means that veterans are reaching out for help. Just a reminder that we offer a vast array of services to include individual and group therapy as well as marriage and family therapy, and we encourage all veterans who need assistance to please reach out. Regarding our vaccine operations that Congressman Weber mentioned, we have administered just under 90,000 doses of the vaccine to this point. We started vaccinating back in December, and we continue to do so. So we're almost at that 90,000 mark, and we're thrilled to offer vaccine to veterans, spouses, caregivers, and now to adolescents 5 days a week for walk-in patients at 6 of our VA clinics, including Beaumont, Texas City, and Lake Jackson. So these are some of the points of care you may want to go to receive a vaccine, and we definitely encourage all vet spouses and caregivers to consider getting vaccinated. And again, I just want to thank all the veterans on the line for their service. Please know that the Houston VA Medical Center is here for you. And if you haven't been to our VA for a while, I would encourage you to come back and to give us a try. We have redesigned many of our processes in the last few years to make our VA system here in Houston more veteran-friendly and veteran-centric. Taking care of your health during the pandemic is critically important, and we want the veterans to know that we are here for them. Again, thank you for having me on, and I just very thankful to be part of this event.
Well, thanks, Frank. And with that, Jason, I'll kick it back to you.
Well, thank you, Congressman, and everyone again for jumping on. Again, if you have a question that you'd like to ask Congressman Weber, Director Vasquez, any one of our panelists that are going to be on tonight, just press *3 on your telephone keypad. Again, *3, you'll be placed in a queue. You'll hear me say that quite often, probably get a little too tired of hearing me say it, but it's important because we want to get to as many questions as we can. One other little housekeeping item, if you have a multi-part question, please do us a favor and ask both of those questions up front. It allows us to move through this process a little faster because, we're going to try to get to as many as we can. So with that, we're going to go to our first caller tonight, Seth Wells, who I believe is calling from Beaumont. Seth, are you on?
Yes, sir.
Go right ahead.
Yes, sir. Thank you for taking my call, and thank you for this opportunity. I work in a disability services organization, and I was wondering why, as the Beaumont VA clinic does not have a wheelchair accessible shuttle that provides transportation services from the Beaumont VA clinic to the Houston VA clinic at this time, and why when can we expect the volunteer shuttle to start back up for those that are ambulatory to be able to go back and forth from the Beaumont VA to the Houston VA? Thank you for your time.
Well, thank you, Seth. And I'm going to jump over to the Director Vasquez for those two questions and see if he can help shed some light on that.
Yes, thank you so much, sir, for that question. We are starting to bring back volunteers to work with us again, and that had been on a hiatus during the pandemic, and we're starting to bring them back. So we expect to be able to start scheduling shuttle rides, and that is something that as soon as we get volunteers back and we start to schedule that, we will definitely share through our social media, through emails, and other ways of disseminating that information. And as it pertains to the van that is handicap accessible, that's something that we would have to work with the Veteran Service, with the VSOs to help us obtain those vans and to see if it's possible to maybe acquire one with that capability. So that's something that we will definitely look into and provide feedback. We can post the feedback and what we find out through our social media, and also share that with Congressman Weber's staff so they can have access to that information as well.
Yeah, thank you, Frank. That's good to know. The pandemic has really, put a hold on a lot of things, and so we appreciate Seth working with that group and the help he's given, and of course the fact that we're going to get it back online as quickly as we can. Jason?
Thank you. And again, if you guys have a question you'd like to ask our team at any time, just press *3 on your telephone. We're going to move right along here to Mr. David Galvin, who I believe is calling from Dickinson. David, are you there?
Yes, sir. Again, I want to echo the sentiments from the previous caller. Thank you for the opportunity and time that you guys have given us to allow us to have a little bit of a voice with some of what's going on. I'll get to the question. I'll cut it real quick and short. I'll talk details later. I retired in 2019. I submitted my paperwork to the VA earlier that year, and I have not seen any movement or heard anything. I know COVID slowed a lot of stuff down. Finally got all my tests and stuff done through the different clinics, the contract clinics, about mid-year last year, towards the end of summer, and I still haven't heard anything. I finally called back. By the way, AMVETS was also originally helping me out with this, and they did a great job, but the VA has told me that there's a stalemate or a stall. They're not receiving the paperwork. My original records haven't been submitted as requested. So I did some digging and some research and found out that there was a message released from the Coast Guard or within the Coast Guard that said records are being placed on hold and they're not being processed. They're being. I don't even think they're getting sent out to the people that digitize the records anymore. If I read that message correctly. So basically, a lot of the service members aren't getting looked at unless it's an emergent case. I just kind of flabbergasted at the fact that they would even consider that as an okay situation, regardless of COVID or not, because COVID's not going to transfer into data. So I'm a bit frustrated. I apologize if I'm getting a little flustered here, but I've been waiting a long time just to get a disability rating, and it's spilling out into a lot of other things that are affected by the fact that me without a disability rating changes a lot of the things that I'm dealing with. So anyway, thank you for your time. I'll sit back and listen and see what you guys have to say.
Well, thank you, David, Mr. Galvin. I appreciate that. And just a little bit of personal note on me. The last of my dad's brothers, there was 5 boys in there. My dad served in the Army in World War II, one of the greatest, last of the greatest generation. We lost him in 2017 on Flag Day. But his youngest brother, Vernon, my last living uncle, Dad died at 92, and Vernon's probably now about 89, I guess. He served in the Coast Guard during the Korean War, I think it was. So we sure appreciate y'all, appreciate that service. Regarding your situation, it may be Mr. Edward Perry that could shed some light on that. Mr. Perry, are you on the phone with us?
Yes, sir. Good evening to everyone. And also thank you for the opportunity to join in on this call. Mr. Galvin, basically in response to your inquiry, I hope that it's possible for us to get your information maybe through the congressman's staff so that we can individually look into your claim. If you're stating that the military or the Coast Guard is informing you that they've not been able to release your records to VA for review, that's something we want to be able to investigate a little more closely, because it is definitely a requirement for us to have your records so that we can review them in the best interest of adjudicating your claim. So if we can get your information to follow up with you so that someone in our office can actually pull up your claim and determine, what the backlog is on getting your information from the military, that would be very helpful to us. And hopefully we can help expedite your claim.
Well, thank you for that, Mr. Perry. And let me just say, Mr. Galvin, I know you're listening, but hopefully you're still listening. Your office number in D.C., because we work for you, your office number is 225-202-2831. And if you want to call in, we may have your number from this call, but we will relay that information to Mr. Edward Perry. And I'm so appreciate him being on the line, being willing to help. So I know you were getting flustered, and rightfully so. So please hang in there. That's one of the reasons, quite frankly, for the call. We're glad to appreciate you getting on the call. I'm glad to be able to help. And we will get back to you on that. So thank you for that. Thank you for your service. And with that, Jason, I'll give it back over to you.
Sure. And let me just, before we go take our next caller, Congressman, we do have Mr. Galvin's number here, and I'm going to pass that along to your staff for follow-up. So we'll make sure we do that. But this is a good opportunity. I know Congressman just gave out his office line, and Mr. Perry, Director Vasquez, I don't know if there's any other websites or helpful information that you guys would like to give out to some of our callers at this time.
How about you, Mr. Perry?
Yes, sir. Actually, I would. Thank you for the opportunity. As many of you know, since the start of the pandemic, the Houston VA regional office had to close down. However, the employees never stopped processing the compensation disability claims in a remote capacity. However, since May the 3rd, our office has reopened for face-to-face interviews on a limited basis to veterans by appointment only. And so I want to give out that phone number to our veterans in the area who may want to call in for assistance or to schedule a face-to-face appointment to come in and discuss your questions and concerns as far as your claims. So that phone number is 713-383-3770. And the phone line hours are from 8 a.m., that would be Central Time, until 3 p.m. So again, we can do face-to-face interviews on a limited basis, but they must be by appointment. So if you have a need to meet with us, please feel free to call that number, and we'll accommodate getting you set up for an appointment.
All right, thank you for that. Jason, we'll give it back to you.
You bet. And again, thanks so much for the information. I know, Congressman, you have an outstanding casework team. You mentioned your number. I know weber.house.gov is your website, and that's a great opportunity, again, for anyone who needs to get some information or reach out to the several offices that you have. So, again, we just hope that all the folks take advantage of those resources. So with that, we're going to move on to our next caller.
Jason?
Go right ahead. Yes.
Hey, this is Frank Vasquez. I just want to give our number for any veterans on the lines to also reach out. The number is 713-794-8642. This is the phone number to the office of Mr. Brent Kratke. He is our Chief Experience Officer, and he'll be glad to get any information, any questions, and coordinate any assistance or any responses we can provide.
Thank you, Director. Would you mind giving that number one more time?
Exactly. 713-794-8642.
Fantastic. All right, we're going to go ahead and once again, if you guys have a question and you jumped on a little late, if you'd like to ask a question of our panel, you can do so by pressing *3 on your telephone keypad. Again, *3. We're going to move on to Mr. Timothy Stroud, who's on. I didn't quite catch where Timothy was from, but go ahead, sir.
Yeah, long-time listener, first-time caller from Houston, Texas.
Good, thank you. Go ahead with your question.
Congressman Weber and Frank, thank you so much for doing what you do. It's great to see Randy out in the public and actually serving the people as an elected official should. And this question is for Frank and his team. And I get all of my care at the Houston VA, and so do thousands of veterans on a daily basis. For those who don't know about the partnerships and activities that you guys do outside the walls of the VA, can you talk real quickly on those points, please?
Yeah, Frank, I guess we'll give that over to you.
Hi, Tim. Great hearing you as always. Can you repeat that again? I was writing a note and I didn't get all of that. Please say that again if you don't mind.
You've got it, Frank. For those thousands of veterans that go to the VA on a daily basis and they get their world-class care there, a lot of them don't know of what you're doing in the community, the partnerships with the different organizations and the activities that you have outside of the VA. Can you touch briefly on those, because that goes hand in hand with the physical and the mental care that veterans are in Houston?
Oh, certainly. Thank you so much for that, Tim. We have extensive partnerships with the community, with community organizations such as Combined Arms, such as Easter Seals, such as other ones that we partner with closely to really share all of the information with our veterans of the different services which we provide. And there are services which we do not provide, since our focus is healthcare. So this network of community organizations that we have relationships with really help us connect veterans with some cares or some needs that they might have, which we don't provide, to really fill some of their needs. And we also communicate extensively of the work which we do with them through our social media posts, through our website, through email communications. Fortunately, our communications officer, Ms. Maureen Diamond, is on the line, and she has a lot of information that is a lot more specific, which she can share. So Ms. Diamond, do you mind sharing more information along those lines?
Yes, sir. Thank you for the opportunity. We are, how you doing there, Mr. Stroud? We are definitely committed to working with the veteran service organizations. We work a lot with American Legions, VFWs, and the county service officers to make sure that we're sharing information with them and working together to help the veterans and fill all the gaps. So we certainly don't ever think that the VA can do everything themselves, and we're happy to work with anyone in the community, including the cities, the counties, and basically anyone that will partner with us to help veterans. We're all in. Thank you.
Okay, well thank you for that. Ms. Diamond.
Well, this is Jason.
Go ahead,
Let me
Jason.
butt in if I can. This might be also an excellent opportunity for Sonja White. Sonja, I know you're on. If there's anything in particular that you guys might be able to talk about from your standpoint.
Good afternoon, and I want to thank all of the veterans that's on the call, and thank you for this opportunity. We do have 2 community care outreach nurses, and we do participate in different events in the community to help expand our network of providers to provide community care opportunities, and we welcome any veteran contact or vendor contact. I think Mr. Stroud even provided us with some vendor information in the past, and we were able to luckily get one of those vendors that he provided us some information on to join our network. So we are open and willing to receive any feedback or contacts for us to join our network.
Okay, great. Thank you. We're going to go ahead and move into our next caller, and I believe it is Donald Drake. Donald, are you on the line?
Yes.
Go ahead, sir.
Yeah, I've never used a VA, and I'm a retired veteran. I mean, a retired Navy, 24 years. I'm 84 years old, and my hearing's going bad. I want to know, how do I get to the VA, or what VA do I go to get my hearing checked? I'm in West Columbia, Texas.
Well, thank you for that, Mr. Drake. This is Randy Weber again, and thank you for your service. Gosh, 20-something years in the Navy. Good for you. And I hope you didn't flood back in West Columbia when Hurricane Harvey hit, because I was down along the San Bernard River, and boy, it was flood city there.
It was.
But how about that, Director Vasquez? Do you think he ought to go to the Houston facility or Texas City? What are you thinking?
Actually, we would like to call this gentleman, this fellow Navy veteran of mine, and we will reach out to you. If you can provide us with your phone number, we will call you and help coordinate everything on your eligibility, on your visit, and on your coordination of your care, so we can make it as easy and as seamless for you as possible. So if we can get your phone number, we will definitely call you today to get more information and to start working with you.
This is Jason. I have that number handy, and I'm going to pass that along to the Congressman's staff, Director Vasquez, so you guys can make sure y'all get a copy of it.
Perfect. Okay, thank you, sir. Appreciate it.
Mm-hmm. All right. Let's move on. Our next caller is Elizabeth Brent. Elizabeth, go ahead.
Actually, I already asked my question. I pressed star 3 by the second time for an accident.
Oh, that's okay. Actually, that was you were asking it to giving the question to one of our staffers, but you're on live now. Go ahead.
Yeah, I did ask the question already. I was saying that my father was a service member. He was in the Army, and he just passed away on the 12th of this month. And there are no benefits, and there were no benefits. And it seems like he paid into the system for so long, and he served our country. There was no benefits for him to be in the hospital. Even for long-term care facilities, they didn't take the VA insurance. I mean, it's like there are no help. When my dad was passing and sick, we went to the Michael E. DeBakey Clinic, and they said his 100 days were up. They give you 100 days at 100% coverage, and then 25 days in a long-term care facility. But after that, they don't pay anything else. And then, paying for the funeral, he only had $1,600 in life insurance. And it's like there's no other help past that. That's just it. So I was wondering if we could get some kind of benefits for they said he had non-service connected benefits. He was a veteran. I mean, he is a veteran and was a veteran. And he served for 4 years, so I didn't understand what a non-service or non-connected service member was. But I just wonder if we could get better benefits for people.
Well, thank you for that, Ms. Brent. This is Congressman Weber again. And how long ago did your dad pass on?
May 10th.
Well, bless your heart. It's been very, very recent. I'm sorry for that. As I said, we lost my dad in 2017. Can we have somebody reach out to you to talk to you to kind of visit with you and see what might be available?
That'd be great.
Okay. Well, we're able to get the numbers from our call out here, so somebody that raises their hand and, so to speak, asks a question. So we'll have the staff call you and see if there's something that can't be done. And listen, we sorry for your loss, and we appreciate your family's sacrifice.
Thank you so much. I appreciate it.
No, you bet. Thank you, Jason.
Always the fact that you're listening and cares makes me feel a lot better.
Well, thank you for that. We certainly, you're a family that has contributed to this country, and we really appreciate that. We will reach back out to you, Ms. Brent.
Okay, thank you so much.
Thank you, Jason.
Thank you. And also, let me say, if anyone has a case or an issue, if you would like us to call you, we will give your number out to the appropriate folks on this phone. We'd rather you not give your number over this line, but we do have everyone's number, so we'll make sure that it gets passed on to the appropriate person. So I just wanted to make sure that we reiterated that. So we're going to go ahead and move on with our next caller, and it's Kathy. Didn't catch Kathy's last name, but she's calling from Friendswood. Kathy, go ahead.
Thank you very much, Congressman, for doing everything you're doing for the vets. My brother was Lieutenant Colonel Kirby Kenneth Kaysen. He flew the KC-135, the flying gas station, and refueled jets, and lost his life in Vietnam. And I lost a nephew in helicopter, Army captain, over South Korea in a helicopter accident. And I was just wondering, I would like to honor my brother. He was retired in Wisconsin. I am in Friendswood, Texas. And I wanted to do something to honor his service, to honor my brother. And I don't know how to get the military cemetery to have a little ceremony. I don't have his body, of course. He's in Wisconsin. I would like to do a little memorial something at the cemetery, for a military cemetery, for my brother who passed. And also, my uncle was the first Black Troop Stallion Army Brigade thing in Chicago, and my other cousin is a colonel in the Army, and he served Vietnam. And I just have so many relatives in the military. I'm so grateful to talk to you. But could you advise me what I could possibly do to honor my brother here in Texas and at a Texas veteran cemetery? What could I do?
Well, thank you for that, Kathy. I'm going to ask one of our VA experts to kind of give their point of view and some examples and some thoughts on honoring, your loved ones that pass on. And so I'll get them on the line. But one of the things we can do too, if you'd like, is we can fly a flag over the United States Capitol and present it in his honor, and get that to you as a memento and a keepsake. And then perhaps there's something at one of the, as you mentioned, the cemetery, something can be done. And I'm not sure which one of our VA folks should weigh in on that. So I'll leave that kind of open to see who might be able to help.
Hello, Congressman Weber. This is Frank Vasquez. We can connect Ms. Kathy with the National Cemetery folks, and so we can coordinate a memorial service for your relative. And well, first of all, thank you for sharing those very heartfelt comments and for the service and the sacrifice of so many of your family members. Thank you so much for that. It's very heartwarming to us, but we will get your number and your contact information from Congressman Weber's staff, and we'll reach out to you to help coordinate all this for you, and we'll be delighted to do so.
Well, I don't know, Miss Kathy is still on, but thank you for that, Frank. And we do have her phone number, and we'll reach out to her just in case. Again, our office number is 202-225-2831. So anytime we can help, we work for y'all. Anytime we can help, please, please, please reach out to us. And again, we do. You're right, Mr. Vasquez. We do appreciate their sacrifice. And with that, Jason, I'll give it back to you. And the thought of me, is two, one of my great staff is reminding me that we can get medals to go along with the flag and have those medals. If they've got medals and haven't received them, we can track down those medals and have those medals presented. So, Ms. Kathy, if you're still on, 202-225-2831, and we'll be more than happy to try to help honor the memory of your loved ones and our great vets. And thanks for calling and, as Frank said, sharing your heartfelt feelings. And, Jason, I'll give it back to you.
You bet. Thank you, Ms. Kathy. We're going to make sure we get that number over to the appropriate staff for follow-up. We're going to move right along to Wade Adair, who's calling from Beaumont. Wade, are you there?
Yes, sir, I'm here. Thank you very much. Thank you very much, Congressman, for the town hall. Thanks to all the VA team that's here. I appreciate it. I am a U.S. Army infantry veteran, served in combat and Desert Storm. And my question is, what movements and improvements have the VA done to recognize Gulf War illness and Gulf War syndrome in regards to providing treatments and benefits for our Desert Storm and our Gulf War veterans?
Oh, gosh. Thank you for your service. And that's a good question. I know exactly what you're speaking of, so I'll turn that back over to the VA perhaps. Well, Frank, why don't you tell us who can answer that question?
I think we can get the most updated information in that from our VBA partners that are on the line. If y'all would please do so. Thank you.
Good evening again. This is Edward Perry. In regards to as far as Gulf War illnesses, I'm not sure if the veteran has submitted any claim for any particular illnesses that he may be experiencing from his service. But that's one of the key things, if we could get a claim submitted. And of course, again, if he wants to provide his information to the staff, we can have one of our staff members at the regional office get in contact with him and walk him through the process of filing for the claim. Also, it's important for him to make sure that he is on the Gulf War registry, where he can register at one of the VA medical centers, which will also help in the research that's being done to determine what are the most common illnesses that are being found from those veterans who served during Desert Storm. And it actually assists in trying to get some of those conditions recognized as being service-connected for that particular era. So, but the key would be to start with getting that claim filed with our office so that we can review your records, your medical service treatment records, any treatments that you've had currently since you left the military for those conditions that you feel are related. And then we can give you a better assessment of what you may be eligible for as far as service connection.
Are you still on the line, Mr. Adair? No? Okay. Well, good. Thank you for that, Mr. Perry, for that answering question. Again, he can reach back out to us. And as Director Vasquez said, phone number 713-794-8642. There for the VA for appointments. And then, of course, our number is 202-225-2831 to y'all's office where you let us work. And thank you for that. And we appreciate his service, too, by the way. And with that, I will go back to you, Jason.
Well, thank you. And I know we have several more callers who have been coming in with different questions about health-related issues. But I did want to, before we take the next caller, use this opportunity to talk a little bit about or give some additional information out about what's going on the VA side with loan production, loan assistance, and also with employment. So, Ms. Cruz, I don't know if you're on the line. You still on the line, want to give maybe an update on what you guys are doing on your side? Did we lose her? I think we lost Ms. Patricia Cruz. So with that, I'll turn it over to maybe Ms. Brookins, if you're on, if you had any information that you'd like to give out about veteran employment readiness. All right, looks like we lost them both. All right, we're going to move on to our next caller, and that is Mr. Alfred Jones, who I believe is calling from Beaumont as well. Alfred, are you on?
Yes, I am. Thank you, Congressman, for this town hall today, and to the ladies and gentlemen there at the VA. I appreciate you being on the call also. Congressman, you know that over the last 3 or 4 years, and especially in the Jefferson County area and in all of your area, your territory, 14, we have went through a lot of storms. And what I wanted to ask you was, especially in the Beaumont area, I know that we did do some things, you know, with the tents and stuff like that, but it just seems like will there be another site or another plan this year going forward? Because I believe that the veterans there in the Beaumont site would like to really know, if there is going to be another place that they can go to there in the area, maybe, with another hospital, Port Arthur, it has St. Joseph's, I think, that's not being occupied. But I just wanted to ask that question of you and the VA representatives, if there is a plan in place this year that they can get out there to the veterans there in Beaumont. Thank you.
Well, thank you for that, Mr. Jones. I'm glad you're from Beaumont. You know, my bride of 44 years, be 45 on November the 6th. Her grandfather was a police captain in the Beaumont Police Department in the 60s and 70s. And so, and her dad, Brenda's dad, grew up in Beaumont. So we know Beaumont. She's actually, she graduated from Neyland High School. She's a bulldog. And, I tell people that she graduated from Neyland, and they go, "Oh, she's a bulldog." And I go, "Yeah, you know her, don't you?" But anyway, so we love that area. And we were actually over there, I think I mentioned earlier, when it flooded out the last time. And that I know of, and maybe Director Vasquez in a minute can weigh in on this, there's no plans to rebuild that, but I will say this, and you're absolutely right, our area is very prone to flooding. District 14 is the first 3 coastal counties of Texas, Jefferson County, where Brenda Gill, my bride, grew up, all of Jefferson County, all of Galveston County, where I learned how to ski when I was a boy, went to the beach, and in the southern half of Missouri County, where I grew up on the north side of Missouri County, so we know this area. We were ground zero for Harvey flooding. We are paying close attention to flood remediation. You may have heard some discussion about the Ike Dike or coastal barrier protection or coastal spine, where we want to keep a surge from coming up our ship channels. If Hurricane Ike 2008, if it had come up the Houston Ship Channel, it would have shut down a lot of the energy production on the Gulf Coast of Texas, a lot of the refining. So it's about industry, it's about people's lives, their families, their homes, and of course our great VA, our vets in their homes and their businesses, and then obviously the hospital and the facilities. So we want to make sure they are as protected as possible. And I think you should be seeing discussion about regional drainage plans and some remediation. So hopefully that's on the way. But in terms of a whole new facility, Director Vasquez, anything? Are you hearing plans about that?
Thank you, Congressman. And, sir, Mr. Alfred Jones, thank you for your service and thank you for this question. And it's a very relevant question to us as we have jointly working with the congressman, with his staff, and with our staff at the Beaumont Clinic. We have weathered significant weather challenges out there. And I just want to give a quick shout out to the veterans for the Beaumont area for hanging in there with us, and for our staff for being so resilient when we have had to set up temporary clinic structures out there. After the last flooding event and the situation where we had to have mobile assets out at the Beaumont parking lot, the clinic went through a total remodel in the inside, and it was refurbished, and it was brought back to a more state-of-the-art construction standards inside, and we did some work and some upgrade to the HVAC system. So the clinic inside has been totally renovated, and it's in really good shape now. Now, in terms of a new clinic, maybe one that is on higher ground that doesn't flood as easily as the Beaumont Clinic floods, We are working on a major lease to find a site where we can build a clinic that is situated in an area that might not be as prone to flooding. The challenge with that option is that major leases and the federal government take years to be put in place just because of the different checks and balances and the approvals and everything else. So we are going through that process, but it'll take several years to find a new place, to build a new clinic, and to open it up. But in the meantime, our commitment is to stay resilient, is to stay ready. Hopefully we don't go through another flood situation, but if we do, we're going to be there for you. We're going to bring out assets. We're going to do whatever we need to do to ensure that our very deserving veterans in the Beaumont area continue to receive services. And we know we can count on the support of a Congressman Weber. He's always there for us, always very supportive. So as we follow this in like a two-tiered approach, one, to be ready for emergencies, to make sure we don't have disruption of services, and then two, to seek this major lease to build a clinic in an area that hopefully is not as prone to floods.
Yeah, well, thank you for that, Director Vasquez. And I don't know if Mr. Jones is still on the phone, but this is something the director is absolutely right. They've been try to be on top of, pardon me, as much as they could. And we've been over there and trying to expedite and get assets moved into place and get as quickly as we can, because as he pointed out, for our great vets, we want to make sure that we're there for the service and show our gratitude. So that's something that we've been discussing for a couple of years, and as Frank V. pointed out, it takes a while. It takes a while. So, but thank you for that question. And with that, Jason, I'll give it back over to you.
Okay, great. Thank you, Congressman. And before we take our next caller, Ms. Patricia Cruz, I don't know if you're still on the line. I think we might have accidentally had your line muted when I called on you earlier. Are you there?
Hi, can you hear me?
Yes, go ahead. I'm really sorry about that. I didn't know if there was any information you wanted to give our callers about VA home loan guarantee related issues.
Well, as far as issues are concerned, one of the things that I would really like to let the veterans know is that currently the interest rates for VA loans are, a few of the lowest they have been in a very long time. So if, there's any veterans on the line that have an interest rate that's higher than 3%, at the moment, now it's a great time to refinance. If they have a current VA loan and they're either, unemployed or their income has been reduced, they can do the VA interest rate reduction loan to refinance their current mortgage, which doesn't require credit and income qualification. So it's just, one of those things that's available to all veterans. And it's something, with the current interest rates being so low, it's definitely something that all veterans should be taking advantage of. And, with COVID and our regional office closing, we are still working. We're working from home. We're working at full capacity. So it hasn't slowed down the VA home loan process. So we're here to serve. We're here to help. And, if veterans are going through the loan process or if they just have general questions about the VA home loan program, our number is 877-827-3702, and our loan specialists are on the phones from 0820 to 1600 to answer any calls that, or issues that veterans may be experiencing through their VA home loan program.
Great, thank you so much.
Great information.
Go ahead, Congressman.
Oh, that's great, Jason. Thank you for getting her line unmuted, because that is absolutely great information for our vets, and so we're so grateful for her being online and giving that input to them. So thank you for that. And with that, I guess, Jason, I'm ready for the next call.
You bet. Congressman, we are going to go to Mr. David Roberts. David, are you there?
I am here. I am also a Desert Storm vet. I spent 6 years in the Navy, got out just after Desert Storm. Historically, I haven't used the VA. I just started the last couple of years because I plan on retiring at 59 or 60, and I won't have medical that I won't have to pay for otherwise. So I wanted to see how the VA was. So in my using the VA just for the past couple of years, and then in February, y'all stopped meeting my medical needs when I got kicked out of the VA clinic down here because I have asthma and I cannot wear the mask that they said is the required mask. I asked about a face shield, asked about any other facial covering, and there is no alternative to the mask they had. So at this time, I don't think the VA is covering my medical needs because you still have a mask mandate, and I want to know when will you come up with an alternative to having a mask that pinches tight around my nose, around my chin, and go to a facial covering or some other, or set up a time for the people that do have breathing problems that can't wear your mask, so we can get our medical needs covered.
Well, good question, Mr. Roberts. Thanks for your 6 years of service. And yeah, it's been a real problem. I know a lot of stuff we've done virtually. Not sure how that may or may not apply, but maybe Mr. Edward Perry would be able to maybe address it. Mr. Perry, you still on the line with us?
Yes, I am. Actually, if he's referring to the health care, he might want to speak with someone from the Michael E. DeBakey VAMC staff or one of their clinics as to their policies.
Correct, and I agree. I'll respond to this, Congressman. Thank you, sir. So we as a federal hospital, as a federal facility, we need to follow the guidance we are receiving from our central office, from the VA central office in Washington, and from CDC. And as of this moment, we have not received any direction to relax the requirement for all employees, patients, and visitors coming to a VA facility to wear a mask. And this is nationwide. It's not just Houston. So I just wanted to point out to the gentleman, we apologize deeply for the inconvenience, but we are mandated to follow this policy. However, we want you to continue to receive care. We want to be here for you. And what I will do, if it's possible, to get your phone number, and I'm going to ask one of our clinicians to call you and to discuss any options we can have to continue providing you care in a manner in which we can be compliant with what we have to be compliant with, and ensuring that you are not going without care. So just give us an opportunity to have that discussion with you. We'll get your phone number from Congressman Weber's staff, and we will we'll reach out to you tomorrow early to have that discussion.
Thanks, Mr. Vasquez.
Yeah, well, thank you for that, Mr. Frank. We sure appreciate that. Jason, I'll give it back over to you.
You got it. We are flagging that number, and we're going to send it on, Congressman, to your staff. Our next caller is James F. Didn't quite catch James's last name, where he's from. I think he's from Dickinson. James, go ahead.
It's Jim Flex from Dickinson.
Oh, Jim. Okay. Go right ahead.
Two-part question. First one was, are y'all going to put this in some kind of a transcript that we can share with other veterans with all the contact numbers, emails, et cetera? The questions and the responses they got on the questions would be helpful to pass around. Also, for 10 or 12 years, we've had funding in place to have a veterans home in Galvin County. They were looking at the Tech City area for years, but because of the building and the 100-year floodplain requirement, that's kind of been put on a back burner, and that's a shame. We'd like to see that the veterans home get built. I know Bob Danback worked very hard to get that approved, and I wonder if we could get an update on it. Thank you. And Congressman Weber, you're a blessing to all of us. Thank you.
Well, thank you, Jim. I appreciate that. And I guess from a staff perspective, working in your office for you, we appreciate y'all and your service, of course, Americans, especially Texans, especially District 14 folks, because we kind of feel like District 14 is special. Putting all the information down, we'll have all the numbers available and all the specialists in the different categories, whether it's as we talked about refinancing homes or some of the medical issues. All of that is available if you reach out to us. My website's weber.house.gov. Actually, your website. It's just got my picture on it. And then the phone number at your office is 202-225-2831. And so we'd be glad to get as much of that information out to share. That's a great idea, by the way. Great idea. And as I said earlier, there's other things we can do in terms of our vets, because we get this question from time to time. Someone has passed on, maybe they didn't get a medal or they didn't get the recognition that they obviously deserved, and we can have flags flown in somebody's honor over the Capitol on a specific date if we know a birth date or something coming up. And give us enough heads up, we can fly a flag. We can help track down medals where we can get somebody that hadn't received their medals they're supposed to. And so I actually thank you for that question, because we do work for y'all. And anytime we have a vet that needs either flags or medals or his or her family, we're always more than willing to go to bat and get those done. And casework too. If you have a question, if you need it to interface with the VA, as you can probably tell, we have a lot of great Veterans Administration folks on the call with us, and they are dedicated to helping our great vets. And I've got nothing but good things to say about them. Every time we've reached out, now sometimes it takes a little digging. I get that, but we're just so grateful for them. So anyway, I just want to say thank you for that question, Jim. With that, Jason, I'll give it back to you.
You got it. And again, we're passing along that information. We're going to move right along to Clarence, who I believe is calling from Vider. Clarence, are you there?
Yes, I am, sir.
Go ahead.
Congressman Weber, I want to first of all thank you and putting this together for our veterans. I've had two brothers, one Army, one Navy served, and I appreciate that you would take the time and to speak to the veterans, which I hold in high esteem regard. The one question that I have is as far as transportation, we have a lot of local people and they're moderate income to get some assistance to getting to the VA facility in Houston, and that's one of the questions. And the other question is I know you mentioned about participation in the volunteers on board to assist in that transport, and if you can provide some information for that. And thanks again, and all the veterans out there, I thank you for your service.
Well, thank you, Clarence, for that, and we appreciate your two brothers. And so, good questions, both transportation issues. There are a lot of volunteers, and there is some transportation available. And quite frankly, I would be at a loss to try to tell you the names of the groups. And I don't know if Mr. Perry or Mr. Vasquez would like to maybe speak to that. So I'll give it to one of them, maybe.
Certainly, Congressman. Thank you. So I will ask you, Clarence, if you would please, to reach out to Mr. Brent Kratke. I will give you his phone number, 713-794-8642. And Mr. Kratke can give you more specific information about transportation arrangements and also how you might, or other individuals that are interested in volunteering to help with transportation for veterans getting down to the main hospital here in Houston. So please reach out to him, and he will fill you in with that information and get all the answers you need on that. And many thanks to your two brothers for their service and for their sacrifice. Thank you for calling.
Yes, sir. And one question: could you repeat that number for me? I happened to pick the one pin in the house that didn't work.
Okay, sorry about that. 713-794-8642.
Thank you so much. And I admitted to mention I have my brother-in-law was also a Navy guy. So, I appreciate you guys doing what you're doing to reach out and provide this information to the veterans, because they are the backbone of this country. And if it wasn't for their service, we enjoy the freedoms that we have here. And my pastor at church, Bruce Lockett, he's very instrumental in the local affairs here. He has an advocacy program that assists veterans in getting their benefits that they're entitled to. And thank you guys so much.
Thank you, sir.
Yeah, thank you, Clarence. Appreciate that. Jason, back to you.
Well, thank you, Congressman. We have time for just one more, I believe. Mr. Gregory, and I'm hoping I'm butchering his last name, Amison. Gregory, are you there?
Yes, sir, I'm here.
Go ahead, sir.
Okay, I'm from Dickinson also. I hear a couple of guys from Dickinson. Anyway, I got a question for you. I was in Vietnam in 1967-68. I was in the infantry. And I was wounded twice, shot twice in Vietnam. I caught malaria in Vietnam. And also, after I got back to the States, after I got back from Vietnam, I had a relapse of malaria. So in 1971 or 2, right in there, after I got out of the service, I filed for disability for 2 gunshot wounds and asked them if I could file for malaria, and they said no. So I was just wondering why, and I'm sure other guys that come back to Vietnam have had malaria. Why isn't malaria a service-related wound? Just like anything else that we caught over there.
Good question. By the way, thank you for your service, and I know y'all are great folks in that era. That conflict don't hear near enough. But thank you for that, and welcome home. We're sad about how y'all were treated coming home. We really appreciate y'all's service. To the malaria question, I don't know who would be able to address that. So I'll lean on my good friend, Director Frank Vasquez, who is a wealth of information. Director Vasquez, what do you think?
Thank you so much, Congressman. Actually, in this case, I will ask for Mr. Perry to answer that. I'm sure he has much better information than I do on that. So please go ahead, Mr. Perry, if you're able to.
Yes, thank you, Mr. Vasquez, and also to, I hope I'm saying it correctly, also Mr. Amison, thank you for your question. And hopefully I don't bore everyone with an extensive explanation of service connection, but in the instance, say, of malaria, when we're looking to service connect a claim, there are 3 primary components that must be in place. So first and foremost, some type of record or documentation or evidence of that illness or injury having been either incurred while you were on active duty or even aggravated while you were on active duty. The second component that we looked for is that once you've left the military, you're now a veteran, we looked for a current diagnosis or treatment of that particular condition that you'd want to claim from your active duty service. And then the third component of that would be a medical professional examining you for that condition that you're claiming and giving us a medical opinion that you indeed have a diagnosis of that condition or some residual from that condition, and that based upon the medical evidence they've reviewed, it's tied to the condition that you developed while you're on active duty. Now, I'm saying all that to say we would need to review your claim and see what the medical evidence actually is showing us as far as the service connection. Do you actually have symptoms that a medical professional would state are related to the malaria that you could have contracted while you're on active duty, or if it was resolved? For the Vietnam veterans, as you know, there are a number of presumptive conditions that are recognized, but those are directly linked to Agent Orange exposure while serving in Vietnam. So malaria is not one of those conditions that's a presumptive, that, in other words, that could be developed years later after you've left service in Vietnam. So if I may ask that the staff get your contact information and forward it to us so that we can at least have one of our subject matter experts, adjudicators in the office, review your claim, and we can give you a clear answer as to what the medical evidence showed, what medical opinion was provided, or if there's even an opportunity such that if you're still having symptoms that a medical professional would say is directly related to those conditions, that we might be able to review it for service connection. But it is not what we would call a presumptive that may develop years after you've left your active duty service. And that's based upon the Title 38, the laws and directives that we received through the Department of VA in conjunction with congressional law.
Well, yeah, thank you for that, Mr. Perry. I appreciate that. I wonder if he's able to go to the clinic in Texas City to start that process, or does he need to come down, make an appointment, of course, for either, I would imagine, or come to the main spot?
Well, as far as for the claim, that would take place at the regional office, which is primarily in Houston, but he wouldn't have to make a trip in necessarily. Again, he could contact us. I have that number I want to give again, 713-383-3770, which is the number to our public contact team at the Houston regional office. If he prefers to access it online, of course, he can go to va.gov, or if there's one of our veteran service partners, either a county veteran service officer or one of the other organizations that may be in residence in Texas City, they could assist him with the claim being submitted to our office. So there are a number of ways that he could actually execute that claim or implement it without having to make a trip to the Houston office.
Well, thank you for that info, because we sure want Mr. Amos to be able to do it as expeditiously and as reasonably as he can. He, for Pete's sake, he put his life on the line, shot twice, and then malaria on top of that, man. So we sure appreciate his service. All right, well, I will yield back to you. Yeah, I will yield back to you, Jason.
Well, thank you, Congressman. Unfortunately, that brings us to the end of our allotment of time tonight. But go ahead. Go ahead.
Hi, this is Barbara Brookins.
Oh, hey, Barbara. I'm sorry we were unable to get a hold of you early. Go right ahead. I know you have some information you want to update us on before we close out tonight.
Hello?
Did we lose her again? Go ahead, ma'am. Hello?
Can you hear me?
Yes, I can hear you now. Go ahead.
Okay. I just wanted to touch in. I was able to log back in, of course. So I knew you asked a question, or if you wanted me to give a brief overview of VRNE or some services that we had. I wasn't for sure.
Go right ahead. Yeah, if there's something you want to update our team on, please do so. We'd love to hear from you.
Well, one of the things I did want to mention was the new program that came out on March 11, 2021. The Department of Veterans Affairs launched the Veterans Rampant Retaining Assistance Program for veterans who had lost their jobs during COVID, the pandemic. They can apply for the services on www.va.gov to determine eligibility. To receive training in some of the high-demand occupations. They will also be contacted by one of the service managers within Veterans Affairs once they have completed a training based on eligibility for assessment of being hired for one of the positions as well. They can go to va.gov to look up a little bit more about the information. Those who are service-connected that are not eligible for Veteran Readiness Program can actually apply for this program and receive up to 12 months of tuition assistance free to include their monthly housing allowance based on their post-9/11 GIBA rate as well.
That's great. Very helpful. Were there any numbers or any information, additional websites that you'd like to give out?
For our program, Veterans Readiness Program, of course, everything is being linked back to, like the Congressman has said, it's been portal to va.gov. If anyone is interested in applying for a Veteran Readiness program to receive employment services or assistance based on the service-connected disability. With the launch of the VRAMP program, they also can apply for this program on www.va.gov as well. I guess that's the main portal for applying for a lot of the educational and training opportunities within the VA. Thank you.
Fantastic. Thank you so much. Well, Congressman, I'm going to go ahead and let you take us out and have the last word.
Well, thank you, Jason. I want to say thanks again to everybody that's been on the call with us tonight. Thanks, obviously, to our great vets. I do want to remind people again, any questions they have, any need to contact us at your office. Your office email is weber.house.gov. Your office number in D.C. is 202-225-2831. And so I want to say, in closing out tonight, I want to say four things. Number one, thank you to all of our veterans. They don't hear that enough, and we want to continue to say that. Thank you, thank you, thank you. And also, number two, I want to take the opportunity to thank all of our wonderful guests on the line, especially our experts and our great folks from the VA and all of the different parts that they play, because they help our great veterans. And we want to say thank you. We applaud you. We appreciate the job y'all are doing for the American people. Number three, I want to say thank you to everybody who's asked a question. Y'all's the questions are important. Your feedback is important. So please follow up with us. We'd love to get you some answers. And number four, I want to say one more time, thank you to our great vets. We really appreciate that. This phone call, this tele-town hall may be over, but our gratitude will go on forever and ever and ever. And Lord willing, we'll even teach that to our kids. I often talk in my remarks about the latest and the greatest, and we need to teach the latest generation about the greatest generation, that sacrifice they made, and that includes really all of our vets. So thank you again to all of our vets. Thank you to all of y'all that are on the line. My team has done an outstanding job along with the VA team. Thank you to all of y'all. And I want to say God bless you all. God bless Texas. And we'll end there. Thank you so much and good night.